So early labor has ended. It is so much harder for you to rest now. Resting does not feel very easy, and if you are able to rest in between contractions, it's pretty much just in positions like hands and knees. Laying on your side has probably gotten very difficult. And you're not sleeping during the contractions, obviously. You are only sleeping in between them. So this is a good sign that active labor is on its way, especially if the contractions are less than 10 minutes apart. So what's gonna feel good, what's gonna help? And I'm gonna show you a tip with my helpful pelvis here. So usually during active labor, your baby is going to be generally in this area of your pelvis, okay? So picture like right where your hips are. So when your partner is helping support you in labor or your doula, they're very likely going to be doing hip squeezes. And hip squeezes is where you take your hands and you press in like this. And kind of the way that I picture it when I'm doing it is I'm pushing their butt cheeks together. And sometimes that's going to be right on their hip bone where that's going to feel good, and sometimes it's going to be a little bit further back. But what I want you to picture doing is you're kind of like pressing so that these bones open, okay? So going to their butt and squeezing inwards, but also picture it like a rotation. Okay, we're pressing in, not squeezing so much as we're pressing in. And again, just like really just picturing the butt cheeks coming together is a good way to kind of like visualize it from the outside. The reason that feels good is because when your baby is in this area, you are opening the top part of this pelvis with those hip squeezes. So that's why it feels such a relief when you're getting those squeezes during early labor, because it's just helping your body do what it's trying to do anyway, okay? So hip squeezes are gonna feel good. Sometimes you can, if you're like in the car transporting to your birthplace, sometimes moms, you can tie a scarf around your waist and squeeze it, or like cross the scarf and squeeze it around you like this, or you can use a spoon to make a tourniquet. So you wrap it around you, you stick the spoon, and then you spin the spoon, and it'll give you kind of like a gentle hip squeeze. Sometimes that can help you cope in the car on the way to the birth center or hospital. So yeah, those things are gonna feel really good. And pretty much anything that just makes your body overall comfortable. If you're cold, blankets. If you're hot, cool rags on your neck and on your face, a fan, stuff like that. So things that generally make a body feel better will likely help in labor too. So keep those things in mind. And I do have recommended packing lists that are in the course that you can check out to give you some idea of some things to pack. So that is going to be kind of what we call early active labor. Hip squeezes, generally keeping, comfort with your body, with like temperature and stuff like that. I have a separate video that I'm gonna go through all of my tools in my birth bag to show you some more detail on what I like to do. Now, as labor progresses and baby is going to move down lower into your pelvis, their head, hopefully their face, is going to be pressing on this area of your body, okay? Very normal, obviously where they're supposed to go, but hip squeezes might not feel good anymore when they get down into this low area because they're pressing on the inside of these bones on your back. So what feels good then is to press right here. That is called counter pressure. And the reason that feels good is for basically the same reason that the hip squeezes feel good when the baby is higher. When you have a joint in your body and you press on that joint, it opens like that. And that's basically what's happening when we press here. We're helping my tailbone is crooked, I need to fix it. We're helping this open and allow baby more easily to come through. So that's why it feels good. Because again, the way I kind of picture it is kind of like holding the door open for baby instead of making baby push on the door so hard. We're just pressing on that joint and helping open that tailbone area so that baby can more comfortably come through. So hip squeezes at first, but when those stop working, don't panic. That's probably a good sign. Try counter pressure instead and see if that works.